right, Clean Freaks, we're back in studio again with Kurt.audette, our Rigid Scope Expert here for 2024 into 25. And Kurt, it's good to have you back in studio to drop some more knowledge bombs on us today. Are you ready for this?
Yeah, I feel like we're becoming like best friends now after all these different episodes, Hank. Looking forward
Yeah,
to it
well,
again.
I thought we were best friends before, Kurt. Did it take
Oh,
all these episodes to make it happen?
no, not at all.
So, we started the sterilization conversation last week, or I should say last month. And we're going to continue into some of that, the practical implications. Okay, so you laid the groundwork. There's a lot of different pathways that your scopes can take. It depends on the the scope design, the scope validation. It depends on the context. Are you in the clinical setting? Are you in the acute care setting? It depends on the processing equipment that you have and what the outcome is that you're looking for. You're looking for high level disinfected. Are you looking for terminally sterilized? But then we get to this just practical piece. Okay, what does this actually look like? And I know that's kind of what we're going to get started with today. So um, how do we practically make these decisions? I guess, and when we do, if we choose high temp sterilization, for instance, how does that impact the flow?
Yeah, great question. So again, we're talking about rigid telescopes only right now. Um, that could be lumened, non-lumened. So maybe it's a semi-rigid that actually has lumens. So something you need to think about. But so when we talk about rigid endoscopes, they have optical glass that is used, no electronics. Semi-rigid uses optical glass, no electronics. So that was covered in either episode 1 or 2, I forget now. So that's one thought. And then the second, and this is starting to evolve as we speak, which Hank, is we have optical glass that carries the image, but we also have cameras that are now mounted somewhere in a telescope. Typically, it's at the distal tip. So when we talk about devices like that, those are classified as heat sensitive devices. So now, if our viewers have watched the previous episode and we talked about low temp, high temp, liquid, whether it's steam, gas, all these different terminal sterilization modalities, now we have to figure out when we look at those two categories of scopes, which sterilization process these can follow based on cleaning validations, to your point, design characteristics. And so those are the things we need to think about. So generally speaking, when we talk about endoscopes that have only optics, these devices, for the most part, can be processed, sterilized in a low temp environment, possibly a high temp environment, possibly a liquid environment. And always, I've said this before, I'll say it again. You need to consult with your vendor and the instructions for use to, number one, clarify which process I can use that isn't going to damage my product, and number two, but should be number one, is how does that affect patient outcomes? So again, optics, we can kind of go through a lot of different processes. The exception would be when we talk about steam or autoclave, and I'm using that term interchangeably. So autoclave, generally speaking, not a flash autoclave. So
Right.
an
Good
autoclave, I
distinction.
I like to compare it to a conventional oven where, hey, I flip on an oven, I bring that temperature up slowly, and then it cooks over a period of time, and then it has a slow cool down period. So I would say most optical glass can work in that environment, assuming that it's been validated for it. But if we talk about flash autoclave, that's like a microwave. Now we're hitting a button and it immediately goes up to a temperature and then immediately comes down. And we both know that glass doesn't like that. And you're going to hear some snap in a glass if that happens. So I just want to make that clear distinction when we talk about, rigid telescopes. They can be autoclaved, but not all can be flash autoclaved. So now with that said, let's talk about heat sensitive. Now we really need to be careful. So telescopes that have a camera at the tip, they obviously cannot go into, or some can go into a liquid environment, some cannot. But most liquid environments with sterilization require high temp. Whereas our low temp gas, is usually some type of chemistry along with it is less than 130 degrees Fahrenheit. So most of the products that have electronics are going to go that path. Okay, I'll stop there because you usually have some really great
Yeah,
questions.
well, I got one that's been cooking here, and it's the obvious one that new techs ask on these devices that are sensitive to liquid. Um, and the question is, hey, it's like this thing's going inside the human body. There, the last time I checked, there's a lot of liquid in there typically, depending on where it is that you're using it. And the liquid could be blood, it could be all kinds of other bodily fluids. Uh, if it can, if it can come in contact with liquid in the operating context, what's the problem with coming in contact with liquid like this in the reprocessing context? What's the difference?
I like your pun, by the way, when they cook.
When they cook, yeah,
So that's an interesting question. Typically in the clinical application, the scope is not seeing any great external pressure being
yeah, that's
presented to it.
exactly what I thought you were going to say, but check
Yeah,
it off the list.
yeah, absolutely. So you and I both know, and maybe some of our viewers, listeners, aren't aware of the fact that autoclaving and some of our other sterilization processes put it into an environment that pressurizes it. So as a part of our design verification processes, we need to allow for that. So we have certain types of seals, O-rings, epoxies that go through a validation process for not only cytotoxicity, and I'm saying that wrong, I know I am, but um, material compatibility, patient compatibility, all those different things. So really great question, but
Yeah,
that's what we need to
it's about the
consider.
pressure. Yep.
It is.
Okay. Well, applying this to the wrap and the filter conversation, like clearly we got some visuals here to talk us through. So, what does this impact, or how does this impact our selection of these products? And then, what should we be aware of the way these products function in this sterilization process now that we're taking this path through?
Yeah, so we're talking about rigids. This could apply to other products as well, but we'll stay on the rigid telescope, rigid endoscope process for anyone who's working in the prep and pack area. And we'll talk about containers and trays and things like that in a future episode. But the questions we have are, am I wrapping it well with polypro, or am I inserting filters into a container? And then I need to understand, is it going into steam autoclave or is it going into gas? And there is a difference, which I'm sure you're aware of, Hank. But these are the questions I need to ask myself. Which filter? Is it a wrap? Is it an insert? And then I need to make sure that I'm using the right filter in those situations. And, vendors have different ways of identifying their filters that are inserted into those containers. Could be labeling, could be color coding. They all have a different way to do it.
Yeah, and this is another really foundational piece of education. If there's any new technicians that are tuning in, uh, it can be easy now. Like just like Kurt just mentioned, though, manufacturers are kind of getting smart about this, and they're helping us on the identification side of things to visually identify more easily if we've got a low temp filter, um, or if you've got a low temp, like even wrap, whatnot, to say, hey, this is queued for this pathway. And then we've got a steam filter that's queued now for this pathway, and they're not necessarily interchangeable. There may be some products on the market that could go either way when we're talking containerization um, or the filter piece. But there's a lot of consumables such as indicators and locks, and all of those clearly have a defined uh, modality that they've been manufactured for. And so mixing and matching, not only is it going to potentially damage the the device if we're putting it in the wrong modality, but it's also not going to affect the sterilization in the way that we're wanting. If we put it in low temp and we have incorrect filters, then that sterilant's not going to get into the device or to the package or to the container. And of course, that's not what we want at the end of the day. So this piece that Kurt's bringing up is really, really important on the error proofing of the process, because we've gone through this whole process, Kurt, of the point of use, the transport, the manual cleaning, the automated cleaning. Now this thing's ready and packaged to go. And if we make a wrong step here, it can be really detrimental.
It's a question, if I could answer it quickly.
Yeah.
It's a question that I get from, our folks here in this company and then our customers. They're asking, what does this wrap or filter actually do? Besides the obvious, we're wrapping it, we're trying to keep it sterile. And, my best explanation, simplest way is it's a one-way valve. It's letting sterilization chemistry in, but it's not allowing it back out. Well, it allows it back out, but it's creating that sterile barrier between the product after it's been sterilized in the external environment. And hopefully that was clear, and hopefully that made sense.
Yeah, well, that's a great segue. That's going to bring us into the next episode here on this series, where we dig into this containerization question, and we're going to define some terms that I think there's different associations or assumptions around. So we'll try to clarify some of those terms on this next one, but then also again dig into the implications of how we containerize and organize these rigid telescopes. Um, and again, it has all kinds of implications for the length of the device life, the safety of the patient, the efficacy of the sterilization process that we're going through. So hopefully you're already hooked on this conversation the way that I am. If you've got more questions for Kurt on anything related, this episode, any episode that we've covered previously, or even a topic that hasn't been brought up, it has to do with this rigid telescope conversation, please get connected with him through LinkedIn. We'll have his email address in the show notes as well. And until we talk to you again next month, keep fighting dirty.